Hi, I'm Andrea. I'm the manager of 2 Northeast, the orthopedic floor at Jefferson Regional. I'm going to talk to you today about a knee replacement and the things that you need to know before and after surgery to be prepared and to answer some of your frequently asked questions. A commonly asked question is, what is arthritis? Arthritis is the wearing down of the end of the femur and the end of the tibia. Typically that cartilage acts as a shock absorber. When that wears down, you have an arthritic knee that requires replacement. The surgeon will use a high-grade metal and high-grade plastic to cap the end of the knee. Arthritic joint, the wearing down of the cartilage that causes the exposed bone, in return causing the pain, versus after surgery when you have those ends capped and helps to cushion that knee again. One common question about joint surgery is if you're a candidate. That's determined by you and your doctor getting together and talking about your previous health history as well as your current medications. Your current activity will determine how well you'll do post-op as well. We'll discuss later how you can help better your chance of a great outcome by increasing your activity as much as you can tolerate, as well as doing some pre-op exercises to strengthen your legs. Patients that are on blood thinners will want to stop those prior to surgery. Let your surgeon know what you take and how often you take it. They can instruct you on when it's best to stop. One possible complication during surgery is infection. Your physician will do all that they can to ensure that this is avoided, including giving an antibiotic during surgery as well as potentially afterward if it's deemed necessary. One of the other things that will happen is the admission testing will call you prior to surgery and they will give you cloths known as CHG cloths to clean with prior to surgery. You will bathe with those from head to toe as instructed, as well as make sure that you sleep in clean sheets and not with pets prior to surgery. This will help to reduce the bacteria that's on your skin, thereby reducing your risk for infection. There is also a risk for pneumonia after surgery. Anesthesia puts you to sleep with a tube, so that can cause some possible complication for pneumonia. Something that you're going to do after surgery when you go home is to make sure that you cough and deep breathe. We often tell people about every other commercial break is a great thought. This helps to prevent the possibility of pneumonia. If you were to start to cough or cough anything up that's colored or have a fever, you would want to contact your physician. DVTs, also known as blood clots, are a risk for any surgery. Your orthopedic surgeon will ensure that they do all they can to prevent this. One thing that will happen is after surgery, you'll be started on a blood thinner of their choice. They'll explain this to you along with the risks and benefits associated with the blood thinner. You will take this to prevent blood clots. Some other things you can do at home to prevent blood clots are frequent walking. You'll want to ambulate safely or walk safely with a walker, but that helps to keep your blood circulating. Another thing is to wear a TED hose or compression stocking. This helps to keep blood from pooling or settling and helps it move and reduces the risk of blood clots. After surgery, many people complain about constipation. This can happen for one of several reasons, including anesthesia that slows the body's processes down. Also, pain medication can keep you from having bowel movements regularly, as well as not walking as often as you used to prior to surgery. So it's really important that you do some things to help prevent constipation, including taking yourself down from the medication as quickly as possible, lessening that amount that you use. We don't want you to hurt, but we don't want you to take more medication than is needed. Make sure that you drink plenty of fluids. That helps to regulate your bowels as well and returns you back to a normal bowel movement pattern as quickly as possible. Another thing that helps is frequent moving. So you're going to want to move as much as you can, as this will help keep your bowels regular as well as get you back to normal activities of daily living. Patients often wonder if they'll have to have a blood transfusion after surgery. This is a possibility, though it's not always the case. One thing that your surgeon will do is ask you to consent or agree to a blood transfusion prior to surgery. You will sign that at the time that you sign your consent prior to surgery. You may wonder how long you'll be in the hospital, and that is between you and your surgeon. The goal is for you to go home the day of surgery. Physical therapy will come and see you in the recovery room as well as your physician to have you walk and determine your level of capability to go home that day. That is the goal, but if you do need to come to 2 Northeast, you'll spend the night overnight and then typically be ready to go first thing in the morning. So that's why it's important for you to have someone with you as a ride. It's also important to have someone else with you to hear certain post-op information reiterated before you go home, including what medications you should take and how to use compression stockings. Equipment needed after surgery can vary from person to person and based on what you already have at home. One thing that we do like everyone to have is a walker of their own or access to a walker after surgery. That will help you to get around safely at home. We also ask in regard to safety that you look around your home prior to surgery and you go ahead and make that area safer. If you have any loose rugs or areas that need to be moved in order to clear a space for you and a walker, we ask that you go ahead and do that prior to surgery. It makes life much easier than doing it when you get home. So again, back to the equipment that you may need, we suggest that you have a walker, a bedside commode. That is something that heightens your toilet. It goes over your toilet and allows you not to have to stoop as low. You're going to find that that's very helpful when you're at home and in pain and you're just learning how to reacclimate to your home after surgery. You may also need a CPM machine after surgery. Dr. Burrell often uses those and some of our other surgeons may also. So that is something that you will place your knee into and it does a continuous passive movement. This helps to exercise your leg even if you aren't actively working. Again, some physicians may prescribe this. If it is prescribed to you, you will be spoken to about this prior to surgery or by your surgeon after surgery, and this will be set up for you by us. One of our case managers will reach out to you and make sure you have the equipment you need. If you are in need of a walker or a bedside commode or a CPM machine or anything else that you and your physicians deem necessary, a case manager will assist you and your insurance company with getting this delivered to you either to your home prior or after surgery. Physical therapy and home health will be set up also by your case manager. This will ensure that when you get home, you have someone to come and look at your incision and report back to your physician in between appointments that are post-op to make sure that you're healing well and that you have everything you need. Home health consists of a nurse coming out to your home to look at your incision and report back any information and updates that your surgeon needs to know. This is helpful for many reasons, including making sure that your questions are answered in between post-op visits with your physician. Also, case management will set up a physical therapist to come to your home. They will work with you on exercises to do after surgery. These will help ensure that you have the best optimal outcome. Patients often wonder if they'll need someone to stay with them after surgery, and the answer is yes. We very much encourage that you have someone, a friend or a family member, stay with you after surgery to help you with everyday needs like cooking and cleaning and getting around the house. Diet is crucial to your healing. Education will be provided to you. In that education, you'll see foods that are rich in vitamin C, iron, and calcium. These foods can help promote healing. Exercises pre-op and post-op are essentially the same. They're targeting certain muscles and encouraging strengthening to prepare you for surgery as well as help you to heal after surgery. These include ankle pumps, quad sets are also important. Those help to strengthen the quadricep muscle, which takes the load off the knee. Also, straight leg raises are an easy exercise to do before and after surgery to help maintain and increase your strength. Patients often worry that they'll be in pain after surgery. Your surgeon will do several things to ensure that you're in as little pain as possible, although it is important to mention that some pain is expected. Pain medication will be given in the recovery room after surgery, as well as prescribed to you for when you go home. Anesthesia will sometimes use a nerve block that helps to lessen the pain that you may feel after surgery. This should wear off on its own in about 24 to 36 hours. You will start to feel that pain come back, and then you can accommodate as you need to with pain pills. Remember, after midnight, the night before surgery, it is crucial that you don't have anything to eat, drink, smoke, dip, or chew gum, or tobacco. This is really important for your safety. We're going to review what's important to bring with you to the hospital as well as what we'd like for you to leave at home. What we want you to bring with you includes a list of your medications. There's no need to bring your actual medications. Just make sure you have a list with what you take, how much you take, and when you take it. Also, it's important that you bring someone with you and have them to stay with you. We want you to have a ride available as well as someone to hear information that we relay to you. We also want you to bring your insurance card and photo ID with you on the day of surgery. Some things we want you to leave at home include valuable items and things that are sentimental to you. We're going to do our best to safeguard those, but it's best just to leave them at home when you can. The day before surgery, you'll receive a phone call from the hospital telling you what time to be here, also reminding you not to eat or drink anything before surgery. It's important that you arrive on time, otherwise your surgery could be rescheduled or postponed. When you arrive to Jefferson, you'll come to same-day surgery. You will sign in where you will wait in the waiting room until you are taken back to same-day surgery and assigned a nurse. There you will have an IV placed and a Foley catheter placed if needed. Your surgeon will come see you as well as anesthesia. Your anesthesiologist as well as your surgeon will come see you prior to surgery in same day to ensure that you have all of your questions answered and that you have your paperwork filled out. At that time, they'll also ask you again which leg is being operated on. We do this for your safety, and this is just another safety measure. Your anesthesiologist will take you to the OR where your surgeon will do your surgery. This usually lasts between an hour and a half to 2.5 hours. After surgery, your surgeon will speak to your family and answer any questions that they have. You will then go to the recovery room where you will be monitored for up to an hour or an hour and a half. You will be woken up and given pain medication as needed. A physical therapist will come see you while you're in the recovery room. They will assist you in walking up to 30 feet or whatever your surgeon suggests. This will help prepare you for going home and being ready to return to normal life. After the recovery room, you will go back to same-day surgery and prepare to go home. A physical therapist will come see you once again. They will help you walk even further and make sure that your questions are answered regarding walking at home. You may also walk with a nurse at this time. If you're in pain, you'll be given pain medication as well as all your instructions to go home. At this time, you'll also have your IV removed and your Foley catheter removed if you had one placed. It's important that you urinate before you go home. When you get home after surgery, there are some things we want you to remember. It's important that you wear your TED hose or compression stockings as often as you can, as that helps your circulation. Also, remember to walk as frequently as you can safely. Another thing that's important is that you remember to take pain medication before your therapist comes. If you find yourself in pain during therapy, you can pre-medicate to help alleviate some of that prior. It helps you to be more willing to walk when they are with you. We don't want you to apply heat to your incision, but you can apply ice. Make sure you have a towel or a cloth over your incision, and you can apply ice for up to 30 minutes at a time. This can help reduce swelling and help pain. One thing you can do after surgery to try to remain safe and prevent falls is to wear well-fitted shoes that have a back to them. Make sure you don't wear shoes that make you feel unstable. We don't want you to fall, as that can cause further injury and delay your healing. Again, we don't want you to lose the ability to straighten your leg, so you're not going to want to put anything under your knee in a resting position. You want to keep that leg as straight as you can while moving it around. Just don't have it resting in a bent position. Ankle pumps are really important to help with blood flow as well as movement. You can also flex or extend your leg as often as you'd like to help to keep that movement going. You may find yourself with some questions after surgery, and there's no problem with that. Make sure you reach out to your surgeon with any question that you have. There are some reasons that we want you to reach out to your surgeon urgently. Those include a fall, increased pain or redness, or a fever of 101 or more. Sometimes infection can appear as an area that's more reddened than it was, or if you have increased swelling or pain. When you leave after surgery, you have a new baseline or a new normal. So anything that is outside of that or something that's a drastic change is something you want to consult your physician about. Also, infection can be determined by having a fever, if you have a cough, if you're coughing anything up, or if you have drainage from the incision. If that drainage has a color or a foul odor, you want to call your surgeon immediately. While blood clots aren't common, they are something that we want you to be aware of. Any patient after surgery can experience a blood clot, though it is rare. Symptoms of a blood clot can include swelling in the calf and tenderness, really increased redness, and again, pain that is far more than what you've been experiencing. We don't want you to rub this area, massage it, or apply heat. If you have any shortness of breath associated with your increased pain and swelling, it's important that you go to the ER if it's not during hours that your surgeon's office is open. After surgery, you'll have a dressing in place on your leg. The home health nurse will come out and check that, change that as prescribed by the doctor. You can be taught as well how to change this at home if needed, along with being able to spot the signs and symptoms of infection that were previously discussed. After you've been out of the hospital for 3 to 4 weeks, your surgeon has several expectations that they would like you to meet. Of course, there are some variations person to person, but we would like to see you achieve some goals, including being able to walk further than you could prior to surgery and hopefully with a lot less pain. We also would like you to get to the point, along with your physical therapist, home health nurse, and physician, that you can stop using the walker as much. Some other things we want after surgery is for you to be able to completely straighten your leg. We also want you to bend your leg more than 90 degrees. So think about when you're sitting down in a rested position, that's 90 degrees. We want you to be able to go even further back than that. This will take time and it will be watched by your therapist as well as your doctor. But it's really important that you do these exercises that they teach you to strive for this goal. If you haven't heard from your home health company within 24 hours of discharge to make an appointment to come see you, please reach out to your doctor's office or to the home health company directly. Again, I'm Andrea. I'm the manager of 2 Northeast, the orthopedic unit at Jefferson Regional. We look forward to seeing you and serving you. If you have any questions after hearing this or anything else that you think of at any point before your surgery, reach out to your surgeon or your surgeon's nurse at Jefferson Regional Orthopedic Associates. The number is 870-534-3449. Thank you.